My Sister's House is a nonprofit organization here in Charleston that is helping to break the cycle of domestic violence through service and support. I talk one-on-one with CEO Tosha Conners for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook. Tosha Conners, welcome to the award-winning Quintin's Close-Ups.
Thanks. Thank you for having me.
You are the executive director of My Sister's House, and obviously your mission obviously is to break the cycle of domestic violence by providing a comprehensive support, services, and education within and beyond the walls of your shelter. What cycle of domestic violence are you breaking right now?
Well, we're trying to break the cycle of domestic violence as it relates, to really the clients and the victims in the Low Country. So we know that when somebody gets with an abuser at the very beginning of that cycle, there's this honeymoon period, right, where everything's great, and that honeymoon period could be a few days, a few weeks, or maybe even a few years, and then it sort of cycles through to the abuse, and then that perpetrator will typically apologize. I'm not going to do this again. Things are going to get better, and then they go back right into that cycle again. And so what we see is this very cyclical cycle for victims and abusers. And what we're trying to do is really educate the victims and the abusers about what's happening, why particular things are happening, and, with the victims that we're serving, how they can recognize those red flags and seek help.
Who are you serving right now in the midst of COVID?
We're serving all victims who are seeking assistance in Charleston, Berkeley, and Dorchester.
Right. And since COVID, how many cases have you all been taken on, and how many people have you actually taken into your shelter?
Well, so we serve around 300 to 400 women and children in our shelter each year, and we've seen those numbers really fluctuate with COVID. So at the beginning of COVID, it was actually pretty quiet. People were scared to leave their houses. We had mandatory lockdowns for a few weeks, and one of the things that we heard when victims were actually calling the crisis line is that abusers would say, if you leave, you're going to get sick and you're going to die, or I'm going to kick you out of the house and you're going to get sick and you're going to die. And that was really at the beginning when we didn't know what the ramifications of COVID were. We didn't know how transmissible it was. So there were all of these unknowns that abusers could really take advantage of. And people were trying to set a new schedule, a new normal, whether it was with their children for school or knowing if they were going back to work or not. And then what we really saw is that as those new schedules and that new normal started to break down, so then people started to get fatigued with COVID, right? Like, tired of wearing my mask, or maybe this official mandate is over and I can go back to work, or I can go back to the store, that the numbers started to rise. So we had more calls, more people were willing to get out of their house at that time, to come into shelter. And, it's coming into shelter is a very scary thing. No matter what's happening, it's always the time that we know that victims are at the greatest risk of being murdered is when they decide to leave their abuser. So couple that with a pandemic and not knowing, if you're going to get sick or if your child is going to get sick, just really compounded what they were experiencing.
How many calls have you gotten on this crisis hotline since March?
We've received a couple hundred calls. Typically we have between, 1,200 to maybe close to 2,000, depending on the year. And we've received a couple hundred, getting closer to 1,000 right now. And a lot of people looking for therapy. And so a lot of people who maybe aren't ready to leave their homes, but we do offer clinical-based therapy either in groups or individually for victims. And we've seen a lot of people reaching out, just wanting to talk, and maybe people who haven't sought therapy before.
And I don't want to bury the lead, but let me jump right into it. This is a headline from WSMV TV, the NBC station in Nashville, and it reads this: Nashville sees uptick in domestic violence homicides due to COVID-19. And this is from Becky Ballard, who is obviously with the Senior Director of Programs for the Nashville Office of Family Safety. She says this, quote, "The pandemic has created a lot of toxicity within homes and a lot of building pressure and tension within homes that may have been easier to release pre-pandemic." And obviously she goes on to say that before the pandemic, they would do in-person collaborative services at their safety center for domestic violence, child abuse, elder abuse, human trafficking, sexual assault clients. Let me ask you this, Tasha, on a local level, what pressure and tension are you hearing about now when it comes to domestic violence and COVID?
So what we're seeing locally is that the intensity of the violence has escalated, right? So maybe there were individuals who were they were being verbally abused in their relationships, and now with COVID, losing jobs and being stuck inside and not having access to services that they typically would. Maybe that verbal abuse has escalated to physical abuse to the point where people are getting knocked unconscious and going to MUSC and calling us from there. And so people who haven't experienced that physical violence to that degree, we've seen an increase in that sort of aggressiveness.
And I know Mr. Ballard went on to say this. Now, with the pandemic, the person who's being abusive in the home can use this pandemic as an excuse to isolate that person even further. So the pandemic is certainly being used as a tool to further abuse. She goes on to say this, that there's also a lot of stress during this time. Quote, if you're adding the stress of a pandemic on top of something that's already abusive, as you mentioned, that always has a lot of issues of power and control within the home, it could be explosive. The pandemic is certainly being used as a tool to further abuse, as she says. What other tools are being known right now?
That's really true, and that's something that we're seeing regionally, locally, and globally. Actually, is that this pandemic does give abusers an additional tool to control the situation, to make their victims scared of leaving the house, of going out. And we know that domestic violence is about power and control, so they want to control that situation or that person. And if you are controlling what somebody sees on television, or if they have access to their phone or not, then you're really controlling the information that he or she is getting, right? And so it's just adding another level of fear. And when we have this pandemic going on, we know that there are a lot of safety nets that aren't in place anymore. So if your kids aren't going to school and maybe they're doing virtual school, you don't have teachers putting eyes on those kids to look at their physical appearance or to see, has that person eaten? Do they have any bruises on their body? If you're not going to church or you're not socializing with your friends. So all of these things that we've, maybe in the past taken for granted a little bit, that there are all of these other eyes on us when we're going out to places, when you're stuck at home and when your kids are home, and that's under the guise of safety. For a lot of people, that creates a more dangerous situation.
And I know more people are buying firearms during this coronavirus outbreak than normal times. What data are you looking at when it comes to domestic violence and firearms?
Well, we know that when there are firearms in the house, that your level of violence and the threat of being murdered significantly increases. So we're always concerned when we know that there are firearms in the house. We don't have any particular data locally as far as our clients are concerned, but that's something that we've definitely been keeping track of and reading as well, and something that we're certainly concerned about.
And I know authorities everywhere are actually worried about reports of rising gender-based violence in the context of COVID and obviously associated lockdowns. What context are you actually looking at when it comes to gender-based violence?
Well, this is really interesting. Typically when you think about domestic violence, it's women, right? And women and children. And we've seen a small uptick for us locally around men who've been reaching out to us. So we know that men also experience domestic violence, and at MSH, typically it's been a lower amount of men who've been reaching out, but we've had several men in the past few months that we've either sheltered or that we've provided therapy services to. So that gender-based violence definitely skews more towards women, and we know that women are more likely the victims of domestic violence. But for us, we have been seeing an uptick in males reaching out to us.
And I know crises can also be obviously further limit women's ability to escape abuse and see their abusers held to account and place victims in an environment without appropriate access to services such as safe shelters, that is. What services do domestic violence need right now in your mind?
Right now, particularly in the Charleston metro area, our victims need access to affordable housing. And I know that's something that gets brought up a lot. But when you look at the standards here in Charleston, housing is the most expensive, and then after that, it's childcare. So think if you were a victim of abuse and you're trying to leave, either maybe you have a job or you're just getting paid minimum wage. If you have children and you're trying to find a place that is affordable, and you now have to find somebody to watch your children, it is next to impossible to find something that you can afford without assistance. So affordable housing is definitely the biggest barrier for our clients.
You talk about assistance. I'm going to go back to affordable housing in just a second, but obviously the Victims of Crime Act is a major funding source for domestic violence, sexual assault, and other victim service providers. And obviously, as you know, is facing a massive immediate cuts and even more drastic cuts in the future if Congress doesn't act. What's new? What's now with this issue?
With VOCA, so in this current grant year, we are experiencing an 18% cut and the potential of a 40% cut and, the next year or two, which would be catastrophic for our agency. That means that we wouldn't be able to provide these therapeutic services to victims, whether they're in shelter or whether they're staying in their homes and reaching out. And that has been one of our biggest growth areas, particularly during this pandemic, is the need for people to have access to affordable, and all of our services are free. So to free therapy, when we're talking about the victims that we serve, they're typically well below the poverty line. They don't have insurance. So it's really the most fragile, the most vulnerable victims. And we're providing a service that nobody else is at a very, very economical cost. So it would be catastrophic for our agency, for our clients, and really for the community here if we continue to see some massive cuts from the federal government.
Let me ask you a simplistic question, Tosha. How should Congress amend the VOCA statute to direct penalties and fines from non-prosecution and deferred prosecution agreements into the CVF, sustaining it with no burden to the actual taxpayer?
Yeah, that's a good question, and that's something that everybody really needs to keep in mind, is that the fines that are going into VOCA are fines from federal crimes, and so they do not impact the taxpayer. Whether you have more money in VOCA or less money, it is not coming from the taxpayer's pocket. So really, it's a nonpartisan issue. And the other thing with VOCA is that they don't allocate all of the funds that they have available. And so I know that there's been some legislation from Tim Scott from South Carolina around wanting to have some sort of standard of the distribution that they're releasing each year from VOCA, so agencies like ours can plan better for the future. I think that would be such an easy fix, just that alone, knowing what the distribution rate is going to be and having it be a set amount each year. You have all of these monies set aside for victims of crime, and they need to use it as opposed to just holding it there.
What is that typical distribution rate?
It can really vary, maybe 10%, 20%. I think what I've read is that it's upwards of 30%, but it's been no more than that. And when you're talking about millions and millions of dollars, that's a lot of money. For us, we receive between $400,000 and $500,000 a year. And when you're talking about millions and millions of dollars, that's a small drop in the pot.
And let me ask you this then. What does your financial restructuring look like right now?
That's a good question. So, in a lot of ways, we were fortunate because the majority of our money comes from federal grants. When COVID hit, the government obviously wanted to keep as many people employed as they could. So we were fortunate in the sense that the majority of our staff were actually paid through these federal grants, and we were able to continue paying them. We also recognize that we need to diversify going forward. And so, whether that's focusing on grassroots campaigns and getting more individuals to donate. And what we've seen when you look at development trends throughout the U.S. over the past year is that people have been very generous, not only to My Sister's House, but to nonprofits all throughout the U.S. They have been incredibly generous during the time of COVID. And so I think people recognize that we have to help our neighbors, and we have to do it in a responsible way that makes sense. So there's a really good return on investment. And we are working on refocusing not only our development plan, but our services, so we can communicate that narrative to the public, and they can understand that, roughly it costs us about $20 an hour to provide therapy to a client. And when you go to individual therapy, you're paying around $125 an hour. So that's a huge cost savings that we're able to articulate to donors, to the community, that we're saving roughly $105 in that situation, just providing therapy to some of the most vulnerable victims in our community.
And what are those development trends, Tosha?
So like I said, a lot of people have been donating, obviously, to human service agencies.
Right.
There's a lot of foundations that have sort of pivoted to focus on COVID-related instances. Something that we want to really point out is that as it relates to domestic violence, there are definitely some immediate needs as it relates to COVID when we're trying to find affordable housing for our clients and get them into a place that is safe and immediate. But we also recognize that we're going to see some lasting impacts from this past year, and also recognizing that COVID isn't finished, right? We're really excited that the vaccine is out, and we're working on getting our staff, on the list to get vaccinated, and we're in phase 1B, which will be very exciting. But COVID is with us, and it's going to be with us moving forward, and we have to know how to navigate and pivot. And we know that there are going to be some lasting impacts on our victims, most prominently, who have been dealing with this isolation from family and friends for going on a year now. And we're going to have to pay attention and put more resources, whether it's into therapy or case management or housing assistance in the coming years, because this is not over.
And what are those other lasting impacts that you're focusing on right now?
So, like I said, we know that isolation is one of the biggest tools that an abuser uses with victims. And during this pandemic, it's been amplified even more, when you're hearing it from your government officials that you have to be isolated for your safety, and then your abuser is able to use that tactic and those tools. That just adds to the trauma. So when our clients oftentimes have experienced generational trauma on top of going through the trauma that everybody is experiencing because of COVID and the loss of the quality of life, we know that it's going to be much more significant for our victims in the coming years. And, we haven't even touched on the children, right? So I'm very fortunate that my children have a loving home. They're not suffering abuse. They get to have food to eat and be with their brothers. But for those children who are witnessing or experiencing violence in the home, for those children who are not going to school, for those children who do not have enough to eat, I think we can hypothesize about some of the impacts that they will have later on. And we know that children who witness abuse have a higher tendency to either be abused later on in life or to become abusers themselves. So we're really concerned about what sort of trends this might create with children later down the line.
What are those current trends when it comes to children?
Like I just mentioned, some of those trends, particularly for children who witness abuse, they become much more susceptible to being victims later on. So when we're talking about that generational poverty and generational abuse, if that is something that you experience every day of your life, for a lot of children and for a lot of adults, really, it becomes normalized, right? So if you're living in a household where your father has abused your mother, and maybe you as a child, you grow up and you start forming relationships where you think that abuse is normal. So if you get your first boyfriend, or you get out of college, or you get married and your spouse starts hitting you, if you have grown up with that in your household, it may not be a shock to you. You just may think, okay, well, that's what happens in households, right? Because that's what I lived with my whole life. And if that is all you see and all that you're absorbing, it becomes very normalized for adults and children. And then they tend to repeat those patterns. And so that's a lot of what we're trying to do at my sister's house. Not only when we talk about expanding programs like our clinical-based therapy, but really our education and training department as well. Getting out there and hosting educational webinars, educational seminars on Facebook and Instagram and any of these social media platforms, because we want to reach children, particularly when they're younger, and let them know that this is not normal. It is not healthy. Let's talk about what healthy relationships look like. And this is how we really want to break that cycle of abuse.
Speaking of which, Tosha, let me ask you this. How much has the demographics in your market changed?
The demographics of the clients that we serve are pretty steady right now, and they've remained steady over the past year. So like I said, the majority of our clients are typically below the poverty line. Racially, I'd say that they're broken out fairly equally among Black and white women. And we've seen an uptick over the past, I'd say 2 or 3 years around Hispanic clients reaching out to us. So that's another piece of the puzzle. If you're an undocumented immigrant and you're here and you are suffering abuse, there are certain protections that you have that you can apply for. But, if you don't speak the language or you don't have a really good support system, you can see how it would be very easy for your abuser in that situation to also manipulate and scare you around your immigration status, despite the fact that if you are a victim of abuse, that there are protections for you, and you probably just don't know that. So again, that would be part of the education and training piece that we really want to get out there and let victims know, despite their racial background or their sexuality or their income or their immigration status, that you have resources and you have rights available to you, and we're here to help you.
I interviewed Anne Francis Legal last week for Quintin's Close-Ups, and obviously her law firm is expanding to help the LGBTQ and obviously Latino communities, and she's actually hired a couple of people who are speaking in those particular languages. Is that the case with your organization?
So we have one Spanish-speaking staff member on staff, and then we have a language line that we can use. So when clients are calling in, they speak a language that we don't speak, that we can use this language line. And we also have some really great volunteers, depending on the language, that have been trained that can help us translate certain things, so we can provide equitable services to those clients.
And, let's talk more about the LGBTQ, because obviously, what are those unique challenges that the survivors actually face?
Yeah, so for a lot of times, with those survivors, it's not knowing. There are a lot of myths that exist around who are the victims of domestic violence, and we know that it doesn't matter what your sexual preferences are, that you could still be a victim of domestic violence, whether you're in the LGBTQ category or not. And it is very difficult, and it's a stigma that exists that we're trying to erase, and let everybody know that, despite whatever sort of characteristic that you or your abuser may have, that here at my sister's house, we are treating everybody equally. We provide services equitably, to all victims, regardless of any of those defining characteristics. It's really about doing what's best and meeting that client where he or she is at that moment.
And I have to ask another simplistic question, but what does domestic violence look like here in Charleston?
That's a good question. So domestic violence can really take on a lot of forms. Obviously, the most obvious form is physical violence. And there are a lot of victims who think that if they're not being punched or hit or physically harmed in some way, that they're not a victim of abuse. And that can also be challenging to try and make victims understand, that there are different types of abuse, right? So aside from physical, there's financial abuse, which is the most common and often accompanies another type of abuse. So typically there's more than one type of abuse that's going on at one time, right? And financial is one of the most common forms of abuse. Verbal abuse, psychological abuse, so making you feel like, we often call it gaslighting. And then, these things can manifest themselves in somebody really controlling the way that you dress, or, you put something on and they're name calling you a slut, or that you look dirty. Just making those subtle references, you might not think as abuse, but after a while, you start to view yourself in a certain way, and it's very demeaning, right? So we know that psychological, verbal, physical, emotional, sexual, even reproductive. So if it's trying to damage birth control, so you get pregnant, so you feel like, I don't have any other options, I'm pregnant, and now I have to go through these steps. That there are all different types of control and different ways that an abuser can really coerce the victim, and that's something that we want everybody to realize, is that it's not always just physical. You're not always going to see somebody with a black eye or with broken bones. That domestic violence or intimate partner violence can really manifest itself in many different ways.
And what is the public health approach to domestic violence prevention in your mind?
I'm glad that you said public health, because this really is a public health epidemic, right? Domestic violence and gender-based violence is huge, not only in our area, but globally. And frankly, we don't give it enough time and attention and resources that it deserves. I think with COVID, what's happened is that it's really brought this light to what's happening, and noticing that people are stuck inside and that this was an additional tool for abusers to use. But frankly, we have not given enough time, effort, and resources to this public health epidemic. I think it's been very easy in all cultures and all different types of society to say that this is happening to women and girls, and mainly, and it's been easy to brush to the side. Also, when you look at some of the federal legislation, when the Violence Against Women Act, VAWA, which was introduced in 1994, that comes up for reauthorization, right? And when there has to be all of this discussion every few years, like, do we want to give this more money or not? Is this worth it? It shouldn't even be a conversation. It should be, yes, we care about these victims. We care about protecting women and girls. Despite what side of the aisle you're on, this is a nonpartisan issue. This affects everybody. And everybody should be concerned because it is happening in your community. When we know that generally 1 in 3 or 1 in 4 women are experiencing or have experienced domestic violence, that's a serious problem. And for over 20 years, when South Carolina was in the top 10, oftentimes at number 1 or number 2 for women murdered by men out of the whole U.S., those are really scary and damaging statistics for our state, and people really need to take notice.
What state and national experts are you currently engaging with to identify the best practices really to deal with domestic violence?
So we work with our state coalition, the South Carolina Coalition Against Domestic Violence and Sexual Assault. So this is the coalition where all of the DV agencies and all of the sexual assault agencies in our state are members. We talk about best practices all the time. We have monthly meetings. We know what's going on, right, in different parts of the state. And we talk to the other executive directors. What sort of trends are you seeing? Are they happening maybe in one part of the state and then they're filtering towards another? Or, when we're looking at some of the larger cities, Charleston, Greenville, Columbia, what sort of trends are we seeing, and how are other agencies pivoting to address these trends? So it's always fascinating to hear from other executive directors. And with our coalition director, Sarah Barber, she's really in tune either with the national agencies, doing a lot of advocating at the national level in DC, and then just having those connections with other state coalitions to know what's happening. So we can have those discussions, whether they're at our annual meeting or our monthly meetings. So we are always trying to figure out how we can sort of take it to the next level to serve clients in the best way possible.
And this might be a silly, redundant question, but how do you pivot with those trends?
Sometimes it could be something as simple as changing something on your intake form, right? Or the way that you ask a certain question. So we always try to remain trauma-informed and victim-centered, which means that if we're asking a question, it should really be because we think it's in the best interest of the client. We're trying to gather this information to help move this person from being a victim to being a survivor. So that's what we're trying to do, right? And we don't want the victim to have to retell her or his story, extra times and sort of relive that trauma if they don't have to. So how can we even streamline the process with our intake? So it's easier for somebody to access services, so it's easier for somebody to communicate with their case manager or with somebody on the clinical team. So sometimes it could be something as small as that, how we are relating to or communicating with our clients, and knowing maybe what they're doing in another part of the state or knowing what they're doing in another state and how maybe they're addressing some of these issues, particularly around housing. There has been a shift, particularly with HUD, to get people housed immediately, right? So this rapid rehousing. The idea is that once somebody comes into your organization, you just get them housed immediately, and then you start focusing on providing all of the supplementary services that they need. So whether it's case management or you're trying to get them hooked up with somebody in the medical field because they need some work done. But the first instance, right, with homelessness in general is like, we've got to get this person housed and then we can provide these other services. So sometimes there are things like that where we've had some pilot programs, particularly around housing, where we noticed and identified this is the biggest barrier. So we had a pilot program where we set aside $20,000, and with clients that we had at our shelter, we provided $350 a month subsidy to women who were working, they had a job, they had worked with our housing coordinator to locate affordable housing, and then we followed them for a year, right, to see what that progress looked like. So we're only providing a small amount of money, but overall, $350 can be the make or break level for many of our clients. And oftentimes they just need a few months, or they just need like that little boost up. It's like, I can do it if somebody can get me to this point. And that's what we wanted to see. So if we provided assistance or funding at this level, then what sort of outcomes are we going to have with these women? And we've had some really positive outcomes as far as, the women retaining their housing, retaining jobs, and being stable. All of the women have been able to do that, and that's something that we're very proud of. So then we've recognized that we have a really good story when we're reaching out to funders or to foundations and saying, here's what we've experienced so far on a small level with our pilot program. We would really like to increase this. We would like to be able to provide the subsidy to women. Again, it's not forever. Some women only need 6 months or 3 months because they have a job and they have things together and they just need that little extra boost. And for some women, they might need a full year because they have never managed finances on their own. Maybe when they were with their abuser, they weren't allowed to, or they didn't have to, right? They didn't have to pay bills. They didn't know how to save their money from one month to the next. And so we have these tools in place to help them with financial management, to hook them up with other nonprofits where they're providing that expert resource, and let's get you started in the right direction. So when we come back, and we're working with you over the course of 3 months, 6 months, a year, and we check in with you, and it's time to sort of part ways because now you're self-sufficient, right? Now you can take care of yourself and your children, and that's what we're really trying to get them to.
This might be a difficult question, but how many barriers are there when it comes to rapid rehousing?
Well, in this area, sometimes it feels like there are infinite barriers. Because affordable housing is, it's almost like an oxymoron in this area. Finding housing that is affordable doesn't really exist. And it's not a secret. Everybody knows it, right? So when the majority of our clients for a 1-bedroom, at the most they can afford is maybe $800. And for most of our clients, that is stretching it very, very, very hard. And when you look at the typical rent in the Tri-County area, and you know that you're going to have to pay roughly $1,000, and that's just for rent for a decent 1-bedroom. If you have children and you're trying to pay childcare, maybe you don't have a car because public transportation isn't the greatest. And if you're living out in Berkeley County or Dorchester County, and maybe you work on the peninsula, how are you going to get to work? Because now you've got to pay for gas if you have a vehicle. You're paying for insurance. You're paying for your car note. So there are all of these things where finding affordable housing, it's not just about the housing, which is expensive to begin with. And then you have a major influx of people who are moving here who either have money or they're retirees from other areas, and the prices keep rising. And let's face it, it's a beautiful place to live. Who wouldn't want to live in the Charleston area? But it strains the resources for those who are here, and it strains resources for those who really can't afford anything else. And so when you don't have that infrastructure in place, when you don't have great public transportation to get people from these rural areas down to where the jobs are, and when you think about jobs typically in this area, how the hospitality industry has always been a major player in that, right? And when you think about COVID and how the hospitality industry has been affected, and for those individuals who've been laid off, then where are you working, right? So we notice that affordable housing has so many challenges. It has so many barriers, not just the location, not just the cost of the housing, but when you're looking at transportation and trying to find a job and trying to find suitable childcare that you can afford, and trying to find access to food, whether it's a food pantry or a church or something, you could just go on and on with how challenging it would be. And so when we hear the most commonly asked question of, if somebody's being abused, why doesn't she just leave? If your husband is hitting you, why wouldn't you just take your kids and leave? Well, it's because of all of those reasons that I just articulated. It is not that easy to just get up and just leave if you don't have the finances or the resources, or if you have been separated from your support system. Abusers do, right? They separate you from the people that love you, that care about you, because that abuser wants to be the only person in your orbit. They want to be the only person that you depend on, where you think nobody else is there to help me, nobody else cares, nobody else wants me, because that's the mindset that you've been trained. So it's very difficult for abusers to make that, or for victims to make that mental shift, and to be able to recognize some of the resources that are out there. But again, there are also a lot of challenges, and we need to do a much better job of coming together as a community to recognize those challenges and, to make change, not just for the victims, but for everybody.
And I have two more questions to ask you, and I know this might be another tough question. I don't know if you have that particular power, I guess, but if you were to talk to a developer about affordable housing, what incentives would you want for a domestic violence victim?
I don't know. Nobody's ever asked me that before. What I would love? I would love a model that I've seen in other cities where, when somebody's building affordable housing, that they set aside a certain number of units for low income individuals, and that they set a certain side a number of units for individuals who maybe are leaving abusive, any type of abuse, but abusive situations, and can't say that there aren't criteria that person needs to meet. But if you want your children to be in a good school district, maybe in Mount Pleasant, how are you going to afford living in Mount Pleasant when there is no affordable housing, right? Or if you want to be in West Ashley, what do those options look like? So thinking about where there's access to transportation, where there's access to jobs, where maybe something is a little more walkable. So, I could walk to this town center area and work at my job, or I could get my child on this bus and they would be in a really good school district and get the best education they could. I think if developers really started to think about setting aside, and if it was mandated from, the local government that was necessary in order to receive some of these tax incentives, if you want to build here, you need to set aside a certain number of units for low-income individuals or for individuals escaping domestic violence, and you have to work with these nonprofits who have access to these clients and really formulate a plan that makes sense, that gets those individuals who need to be in those units in those units.
And I won't ask you so many more questions, but let me end right here. How do you, let me talk about it in generalities, how do you disrupt the developmental pathways towards partner violence?
I'm sorry, can you say that again?
Yeah, how do you disrupt the developmental pathways towards partner violence?
How do we disrupt that? I think it's a multifaceted approach. We disrupt it with awareness, right? So getting out on programs like this, letting people know that there are people who care, who are doing something about it, that you are not alone. I think that's one of the biggest mantras that we try and reiterate within our agency and to the clients that we're working with, is that you are not alone. We are here to help you. And not only us, but there are so many other agencies, churches, civic groups, people who really care about this issue. So I think it's spreading awareness so that everybody knows this isn't going to be a hidden topic anymore. This is not taboo. This is something that we want to put front and center, that we want to be on billboards. We want it to be splashed everywhere, that this is a problem in our state. We recognize it, we care, and there are people doing something about it. And then I think the next step is definitely education. We have to get some really strong programs in the schools. We have to start young with our children, teaching our children about healthy relationships. What is acceptable and what is not acceptable? What is healthy and what is unhealthy? So as that child matures and goes through puberty and grows older, that they have a really solid foundation of what our community agrees upon is acceptable and unacceptable, and generally speaking, what does a healthy relationship look like? So we all are working off a standard set of norms and people feel comfortable moving from there, I think education and awareness are key, and it's something that we don't, as a community, really pay enough attention to. I think it's been very taboo, and people are nervous, they're ashamed. Nobody wants to say that I'm being abused at home, and I totally get that. But we have to also say that this is happening in all of these socioeconomic ranges. So even though the majority of our clients are at or below the poverty level, we get every year, and we've had this year, we get women from Isle of Palms, from Mount Pleasant, from Sullivan's Island, who come from extreme privilege and who are also suffering from extreme abuse. So we need to recognize that it is happening at all different levels, and that we're here to do something about it.
Tosha Conners, thank you so much for your time. And again, welcome to the award-winning Quintin's Close-Ups.
Thanks so much for having me, Quintin.
You're very welcome.